Unfortunately, rheumatoid arthritis is a chronic condition. It means that you have to take something to manage it over time. So generally, patients will have to take some forms of medication lifelong. Compliance is a huge problem in all autoimmune disease, especially rheumatoid arthritis, and that's because the disease naturally ebbs and flows. You naturally have some flares and periods of decreased activity, and no one wants to feel like they're sick. So many people feel that they may be cured or maybe it will never come back, and they stop taking their medications. This is actually a really big mistake. First, because sometimes there's inflammation that's ongoing that you don't know about, but it's damaging your joints or it's making you more likely to develop cardiovascular disease. Also, it's much easier to control disease than it is to have a flare and then bring it back. So it's very important to continue on the medications even if you feel well. And then also, steroids tend to make patients feel better quickly. So a lot of patients have just a stock of steroids at home and they maybe don't take their DMARDs as well, and then when they feel badly, they'll take some steroids. This is problematic because steroids have many side effects. So they increase the cardiovascular risk, they raise the blood sugar, they cause obesity and thinning of the bones. So we really don't want patients to be taking steroids for an extended period of time. And I think patients are very concerned with side effects. Because the immune system is the number one defense against infections and early cancers, there are some risks of heightened infection and a slight risk of increased cancers, namely non-melanoma skin cancers and lymphoma. This risk is actually quite minimal, but I think that patients tend to worry about the risks of medications more than they worry about the risk of disease. And, if these medications were more risky than ongoing rheumatoid arthritis, we would never give them as physicians and as a medical community. So I think that the concern with putting something in your body, especially for long periods of time, tends to weigh on patients. If a patient is concerned about the side effects of one drug or concerned about the dosing of a drug, just tell your doctor. We have very many options and new drugs are coming out every day. So we're able to really tailor therapy to what it is that the patient needs in their lives.